On today's episode of What's Up Doc, we're discussing varicose veins. Did you know that 80% of adults between the ages of 18 to 80 will develop some form of venous disease in their lifetime, and that 1 in 4 persons will develop significant varicose veins? Varicose veins is a serious medical condition that causes significant pain and debility. It is a progressive disease, and if left untreated, can develop into painful, weeping venous ulcers around the ankle. These affect a person's ability to weight bear and walk. Life is movement, and if we hold this to be true, then varicose veins affects lives. Joining us today to share his knowledge and expertise on varicose veins is Dr. Fidel Rampasad, consultant, vascular and interventional radiologist, and lecturer in radiology at the University of the West Indies, St. Augustine campus.
On today's Vitaminutes, we discuss pantothenic acid or vitamin B5. Vitamin B5 is naturally present in foods and is used to make coenzyme A, also known as CoA, a chemical compound that helps enzymes to break down and build fatty acids as well as perform other metabolic functions. Vitamin B5 is found in almost all plant and animal foods to some degree, because the vitamin is found in all living cells. The best sources of vitamin B5 are fortified cereals, organ meats such as liver and kidney, beef, chicken breast, mushrooms, avocado, nuts, seeds, dairy milk, yogurt, potatoes, eggs, brown rice, oats, and broccoli. And that was today's Vitaminutes.
If a person has varicose veins or has any form of valvular insufficiency, how would they present? What should they be looking out for?
Well, yeah, it's a good idea for everyone to look at their legs and see what they look like. Because there are many different conditions that can affect the legs. Varicose veins in particular, you might see little prominent veins, tubular veins. Sometimes they can get very enlarged. Sometimes you can see little fine veins, they call them spider veins. And as the disease spectrum progresses, these veins might get a little bit tender, they get more swollen, you might see some swelling in the ankles, some discoloration of the skin, and the legs feel heavy and tired, and you'll actually see swelling at the end of the day. And when you go to bed at night, by the time you get up in the morning, it's good. And this is primarily occurs in patients who stand a lot during the day. And then things progress. If left unchecked, you can start to develop more pain, more swelling, then the skin starts to actually break down and you get what people call a sore or ulcer forming. And that can be very, very difficult to treat. And sometimes it might respond to antibiotics, get better, and then it comes back again. And the typical symptom that is a severe symptom, worrying symptom, is when you get the thinning of the level of the ankles. So they call it an inverted champagne bottle. So it looks like an upside down champagne bottle. So that's a severe form of varicose vein, venous insufficiency disease.
All right. Who is at risk of getting it? Is it everybody, or certain people are at increased risk of developing varicose veins and even venous disease?
Yeah, sure. So you might expect it to be in certain populations, and sometimes when you ask the patient the question, they will say, oh, well, my mom had it, my dad had it, my sister has it. So it runs in families, and some of them pop up spontaneously, like, for example, during pregnancy. And as you get older, the veins lose their elasticity, so you get more varicose veins in an older population.
Right.
And sometimes it can be secondary to congenital problems, like there's an interesting syndrome called May-Turner syndrome, where you get the symptoms on the left side. So
Correct.
that's rare and unusual. It can be sometimes related to masses within the pelvis, so fibroids compressing the veins, etc., which is a common cause here. Mm-hmm. So it's important to sort of know who is predisposed and be able to diagnose underlying causes, because it doesn't make sense you address varicose veins, the next thing you have a bigger problem going on higher up in the body.
Correct. Would you say also somebody who leads a sedentary lifestyle, not exercising regularly, does that have an impact on the condition of your legs?
Yes, because I think, well, if you believe in evolution and how humans evolved, we weren't initially erect. so that the way that the veins take the blood back to the body, there are little valves that prevent the blood from going backwards. So as you move, the muscle carries the blood back up to the heart. And in patients who have sedentary lifestyles, the muscles are not as efficient as they should be. And yeah, I think that predisposes to varicose veins as well.
You think obesity as well then?
Yes, yes, definitely. But sometimes you do see very slim patients like yourself who have varicose veins. So it's not just obesity. So I've seen a lot of, especially tall people, and you just see this really, really bad varicose veins. So obesity is a factor too, but you can also get it in slim people.
Do you see a predilection of an increased incidence of women having varicose veins more than men, or is that just a myth?
No, I think it's definitely more prevalent in women. And women might tend to more present to their doctors over men, in terms of men might just ignore the problem and say that's not an issue, but generally speaking, it's more common in the female gender. It may have to do with some hormonal issue with the female hormones predisposing.
Right. You say birth control can increase your risk of developing it as well.
That is a known risk factor.
Yeah, both the injectable as well as the oral contraceptive.
Yes.
So, all right. Now, let's just say a patient has a job that requires them to stand for long periods of time. Let's say a nurse, for example, in our setting. And she's a little bit overweight. She works so hard, she doesn't have time to exercise. She has tired, heavy legs, swelling. At the end of the day, what does she do next? So she thinks that she has some form of venous disease. What can she do next? Well,
she needs to consult a physician, right? So the first port of call is usually a general practitioner. And they will examine the patient and assess, well, okay, yes, there's some varicose veins. Is it really something to take a little bit further? Or should we refer for an ultrasound? Now, some may say, well, if it's minor and there are not so much symptoms after taking a proper history, and there's some little few veins there that are prominent, the general practitioner might usually advise the patient on some certain conservative measures to follow. And if that doesn't work or that doesn't help or relieve the symptom, he might ask for an ultrasound scan. So there's a special type of ultrasound we do called Doppler ultrasound that actually looks at the way the blood flows within the venous system in the legs. So because you can see varicose veins with your eyes, you don't need an ultrasound to confirm that. But a lot of people, including doctors, don't realize that there are a lot of abnormal pathways that form when you have varicose veins, that if you don't address these abnormal pathways and these leaky valves, and you just treat the varicose veins, for example, you pull it out or you tie it off or you inject it with something, and you don't treat the underlying condition, it's going to come back in different spots and the symptoms are going to continue and progress.
So this is why I asked you to come, and I wanted the viewers to understand why a radiologist, and specifically a vascular interventional radiologist, would be involved in varicose veins. I mean, so as radiologists, we diagnose and get to the root cause of what is causing your varicose veins. And once we've figured that out, what are the various options, treatment options that are available in Trinidad and Tobago for persons with varicose veins from mild to severe?
All right, so let's look at some of the things we could possibly find when we do an ultrasound. So an ultrasound is a modality, what we refer to as a modality or test that we use in radiology. And well, for the audience that may not know, a radiologist is a doctor who specializes in the use of imaging technology. So for example, X-rays, ultrasound, CT scan, MRI, right? And ultrasound is one of the most widely available modalities, and it does no harm to the body, so there's no radiation involved. And we can actually, the most common use for ultrasound might be pregnancy. So everybody knows they get an ultrasound during pregnancy. But Doppler ultrasound is a type of ultrasound that looks at blood flow. And when we look at veins, we look at in a vein, the blood is supposed to flow back to the heart. So from the foot, it's supposed to go upwards to the heart.
Against gravity.
Against gravity. And there are little valves and whatnot that prevent it from flowing back down, because gravity by nature will want to take it back down. So sometimes those valves not working properly. So the typical place it might occur, it's up by the groin and behind the knee. There are two major valves there that might not be working properly, right? But there are other little points that this venous system can become abnormal. They're called perforators. So you have blood coming in to the varicose veins from these perforators that if they're not addressed as well or diagnosed, varicose veins will continue to come and come and come and come, and even though you're treating some of them, they might come back other spots, right? So the ultrasound looks at that. It looks at the blood flow, it looks at the leaky valves, it looks at where the varicose veins coming from so that you can plan your treatment. The ultrasound also looks for the presence of clots. So there are clots in the legs, or what they call deep vein thrombosis, that can actually predispose to varicose veins and also sort of limit the treatment options that are available, right?
Because you have to treat that DVT, exactly, as it's called.
Because that's a cause for lower limb swelling. And the varicose veins might appear because the body is trying to form alternative pathways. And next thing you know, you go and treat that, and you've left an undiagnosed DVT there, which can be life-threatening because that can break off and go to your lung. Let's say it's a huge mass within the pelvis, like an ovarian mass or a uterus that's enlarged and riddled with fibroids. And if you don't diagnose and treat that, then you're treating the varicose veins, but you've ignored a big problem up here.
The root cause.
Yeah, so that's why it's a team approach. And I wouldn't like to say that radiologists alone should do it. Of course not. We work as a team. So that's why I always believe in the port of call, because me personally, I don't, not that I don't like to, but I don't have the time to address and sit down and talk to patients at length and what were their problems and see how they, time is a limiting factor. But the general practitioner, the vascular surgeons and people like yourself, the vascular radiologists who will have the time to explore the different facets of the patient's symptoms, these are the people who should be managed. It's a team approach. So oftentimes in the setting, the clinical setting, a doctor will suspect varicose veins, confirm it on examination, try some conservative measures, things like exercise, lose weight, wear some stockings, take some medications like Daflon, etc. And if it's not working, then they will send for an ultrasound to somebody like myself or yourself. And it's also important to know that not every ultrasound is an ultrasound, okay? Not everybody who does an ultrasound is specialized to look at it and do the scan properly, right? So they might go for somewhere that says ultrasound available, and they go there and they do a scan, but it's not done.
And it's missing the boat. It just probably looks at for clots and the big picture, but not the nitty-gritty, which is where you come in. You come in terms of, as an interventional radiologist, you do what the general radiologist can't do, which is to intervene and treat the underlying or root cause. So let's say I have a patient who has severe varicose veins and severe valvular incompetence of that valve you're talking about at the groin or the back of the knee, the SFJ or the SPJ. Describe to the viewers out there, what are the treatments that you would offer at your practice, or what would you recommend in general that are available right now in the country?
So basically the problem at those are major junctions where you have these major valves. And the valve is like, I don't know if you know much about plumbing, it's like what they call a check valve, right? So a check valve is really a valve in a pipe that only allows the water to flow in a certain way. It's not going to flow backwards. So once the water passes that check valve, it's not going to come back, right? So the problem with varicose veins is that, remember I said it's supposed to flow up to the heart, right? That valve is not working. So blood is flowing back down. So when you stand up, it's going back down. It's going through the valve. The valve is leaky, right? Now, one will say, well, can't you fix the valve? No, that valve is not amenable to being fixed, right? So you have to take it out. In other words, when I say take it out, I don't mean surgically, although that's how they started treating it. But you have to eliminate that problem by sealing off that vessel. And
how do you close it off? How do you seal it off?
Right, so initially there's something they used to call a high thigh ligation. The surgeon used to go, as general anesthetic, go and cut down to that area and just take a suture and tie off the vessel.
And what do you do now? What is available now?
So now we can easily use ultrasound to find the vessel, and we go into the vessel with a little wire, and then we use something called a radiofrequency element. So it's a little probe like around this long. It has a heating element, like those hot plates that you hot up little bologna and thing on, right? It's very similar to that. It heats it up to 100 degrees, so it actually burns it off on the inside.
And the patient doesn't feel any pain, so this is a relatively non-invasive same-day procedure that is available for the treatment, and it's definitive treatment, correct?
Yeah,
of varicose veins.
It's actually better than surgery.
Yeah.
Researchers show that over many times. Because when you do surgery, you're just treating that spot. Because remember, you're not going to cut down the leg, right?
Right.
You're just tying up the vessel there. But this thing treats the whole vessel. So we usually come down by the knee there, and we send up the catheter using it. It's brilliant, right? Because you're seeing, yeah, I wouldn't say it's painless, but we have strategies to mitigate the pain. But it's very, very effective. Because remember, so
our time is out.
Right.
I'm so sorry. But before we leave, I just want you to just leave the audience with at least one piece of advice, one gold nugget that you want to leave with them in terms of varicose veins and what they can do to change their lives, to make a difference, to reduce their risk.
Yeah, as you said, it's not just a cosmetic problem. It can be indicative of something else that is going on. It can also progress into ulcers and a lot of discomfort and disability in your life. If you do have swelling, pain, you're seeing also skin darkening, check your doctor, check your radiologist, ask them to send you for a Doppler ultrasound to try to diagnose the problem so that you can manage and treat it before it gets worse.
Great. Thank you so much.
All right.
As you age, there is an increased risk of being diagnosed with arthritis, but younger individuals can get affected as well. When you tell them, but no, I need you to move your joints, you need to move it, otherwise it gets stiffer and it exacerbates the problem. There's that misconception that if I move it, it's more pain.
So if you're to focus on these risk factors, then to me, it will help a large portion of the population, probably prolong, I should say, the inevitable, because inevitably you will develop arthritis.